Welcome to this demonstration / tutorial of Med-Pos. Med-Pos is a benefits calculator that determines the patient's out-of-pocket financial responsibility. It streamlines benefits processing with simplified insurance carrier protocols. Upon login, the benefits calculator screen appears. When a new patient schedules, the benefits staff interfaces with their insurance and follows a preset sequence of questions to input their coverage parameters. The software structures the input of information so that all possible scenarios are covered. Take, for an example, a new patient. New patient is selected in patient ID. The patient's identification from their EMR or chart is inputted. Date of birth. Their insurance is selected from a drop-down menu. Their insurance ID is taken from their cards. The staff responsible for this benefits acquisition is inputted. The date is populated. The doctor is selected from a drop-down menu, and the tax ID is populated. At this time, the insurance is contacted. The insurance representative is inputted. Patient's active date of insurance is inputted. The network is selected, patient in network, and the reference number of this call is selected. Patient's deductible is inputted. The deductible met is inputted. Patient's out-of-pocket max is entered, and the out-of-pocket max met is entered. The patient requires a referral. This is selected. This unlocks the following three boxes where the information concerning the referral is added. And the doctor's phone number. Subsequently, this can either be saved at this point, or we can continue on and fill in the remaining information. This information concerns the insurance benefits. As you may have noticed, the allowed amounts were populated when the patient's insurance plan was selected. If the patient had a different insurance, different information would populate our allowables. We'll go back to Blue Cross Blue Shield. The benefits staff interfaces with the insurance and requests the following information as to whether the deductible applies or not to each CPT code. And this is done for the totality of the CPT codes. Whether the patient has a copay, and then the patient's percentage coverage. A notes section is filled out if the patient has any particular parameters, any exclusions, any plans with a copay max, etc. Now what we're going to do is we're going to go back to an example that was saved. If this was a new patient coming in for the very first time, the CPT codes for that visit will be selected, and her out-of-pocket responsibility will calculate. The patient will be informed prior to appointment as to her out-of-pocket expenses, which will be collected at the point of service. As you notice, the total charges include the 2 CPT codes, and without going into each particular facet, the patient will have a $34 out-of-pocket responsibility. The patient can have a printed receipt, and this can be printed for their records. Basically, we'll resume what we had found initially. The second part of the Med-Pos is the practices database. This is the allowable amounts for the office or practice. This includes all the insurances, it includes all the CPT codes, and all the allowables for each insurance CPT codes. This information can be edited, new CPT codes can be added, description added to this database. It's very easy to change all these different data points. You can remove a CPT code. Want to do that, selection of the CPT code, delete. Want to add an insurance company, you go to the insurance company, you can add it, you can remove an insurance company, delete it, and you can remove patient profiles. Most of these are fairly simple and can be updated punctually with new EOBs as allowables change. So, to resume, Med-Pos is a cloud-based medical benefits calculator. It is designed to streamline the implementation and collection of out-of-pocket expenses at the point of service.